Good afternoon. Thanks for joining Family Caregiver Alliance for Oral Health Techniques for Caregivers. I'm Calvin, Education Coordinator at FCA and your host for today. For over 4 decades, Family Caregiver Alliance has been working across the Bay Area and the nation to improve the well-being of family caregivers. We offer support through consultations, classes, workshops, retreats, publications, and advocacy. To learn more about Family Caregiver Alliance or access our online research center, CareNav, please visit us at caregiver.org. During this webinar, if you have any questions, please use the Q&A box on your screen. We'll answer as many as we can at the end of the webinar. We're also going to be asking you to provide a little bit of feedback, so I'd like to thank you all in advance for filling it out. And finally, this webinar will be archived and the slides available to view later on for your reference at our website. So today I'd like to welcome our guest, Dr. Rosa Mathai. Dr. Mathai is a general dentist in private practice in San Francisco. She was formerly the chief of house call services with the house call dentists and on staff at Kaiser Permanente and CPMC hospitals in San Francisco, providing dental care in their operating rooms and emergency care to inpatients. Dr. Mathai's clinical experience spans nearly a decade of practicing safe and comfortable dental care for geriatric and special needs adults, especially those with complex medical needs. So now that you know a little bit more about today's presenter, I'd like to turn things over to Dr. Mathai.
Yes, thanks so much for the welcome. I am Dr. Mathai. I'm excited to discuss oral health with all of you. I'm assuming the audience, most of you may be are caregivers, maybe for a long time, or maybe newly thrust into this role. So I am eager to share my knowledge with you in ways that hopefully will be relevant on a daily basis to your practice. So Calvin, you can advance the slide. So some objectives I have. As a caregiver, I want you to come away from this discussion understanding your role in helping your loved one in maintaining their oral hygiene. And even if your loved one doesn't express a desire for needing dental care, for example, and I'll definitely get into that kind of point later on, I want you to have a basic understanding of what is good oral health and what is good oral hygiene, and understand why this is relevant to good overall bodily health, your mouth. And I'll review specific techniques that you can employ and help you figure out when you need to get somebody else involved, like a professional, to augment your efforts, and give some suggestions on how and where to get this professional help from a dentist or a hygienist. So next. So in a nutshell, more people are aging in this country and with more teeth or appliances that replace teeth. Although there definitely are difficulties and challenges and equitable access to care overall in healthcare today, in general, most people do have a better sense of the need and importance for having good oral health or having teeth to begin with. In the next slide, if you can advance. This is just a chart from the US Census Bureau detailing how this country's projected population growth of those age 65 and older is only set to expand. So more adults with more teeth, and in particular, you as a caregiver, you're a part of a cohort that should be growing as well. If you can advance the slide, please. So with all the things that you have to worry about now as a caregiver, why should you also worry or be concerned with oral health? Well, in the most basic way, teeth are necessary to eat. Okay, without teeth, you might be able to, with a special liquid diet, gain adequate nutrition, but without teeth, you can't chew. And so the consistency of your food is greatly limited, and that limits your ability to enjoy food. So chewing and satisfaction are completely linked, and it's linked also with lower stress, feeling better about your life. It's, in a nutshell, something everyone can and should enjoy into your old age. It's also linked with increased cognitive function. Your teeth and your mouth are also a big portion of your face and the musculature of your face. And as humans, we use a lot of nonverbal cues as well as verbal cues to communicate with each other. So even if, say, your loved one is nonverbal, using facial expressions, which are influenced by teeth being present and holding up the jaw, are very relevant. And the teeth themselves, along with your tongue and muscles, the positioning of the teeth directly plays into how you're able to speak. And without this ability to communicate or this ability to chew comfortably, especially if there's pain, you might notice changes in affect or behavior, which again are not ideal. And then simply put, having healthy teeth and a healthy mouth is important for preserving your overall general body health. So next. And this is because, simply put, your mouth and your body, your mouth is a part of your body. So your oral health and bodily health are inexorably linked. Okay, so your mouth is a major portal of entry for substances from the outside world to the inside of your body. And so anything that goes into your mouth is going into your body. And there are links between oral and total body health that I'm going to get into briefly, such as heart disease and pneumonia, diabetes, and Alzheimer's. And the converse is true. Changes to your body can affect your mouth organ, such as if your loved one has had cancer, or you have had cancer and had radiation therapy. This can change the saliva quality in your mouth, for example. Xerostomia is the clinical term for dry mouth. And this is something that does disproportionately affect older adults, and often because of other medications ingested and used to treat other parts of the body. And it becomes relevant to the comfort and dental health of your loved ones. So next, please. So when I talk about dental disease, really falls into broadly two categories. One is getting cavities or caries, but the other that I really want to hone in on is gum disease or periodontal disease. And what this is characterized by an inflammatory process of the surrounding structures around teeth, and it's chronic. So food broken down by periodontal pathogens or microbes like bacteria in your mouth. Food becomes dental plaque. It's like a broken down form of food that, if left alone and unbrushed away, hardens to tartar or calculus. And as it persists around the teeth and gums, it starts by causing the gums to swell and inflame. And over time, it causes the destruction of the support for the teeth. The jawbone around teeth starts to melt and disappear, and this causes teeth to become infected or painful and loose and eventually lost. And it's quite prevalent. It's something that is more likely in an older population because teeth have been around for a longer time, but it certainly affects young adults as well. And the reason it's so relevant to overall body health, more than just the risk of losing teeth, is that this is a bacterial process, an inflammatory process, and one that your body doesn't want. It's something that your body's constantly fighting. So your gums, as chronic reservoirs for bacteria, this bacteria can then seed to other organs in your body. And the inflammation that it creates of your body constantly try to fight this losing battle also has negative effects on the rest of your body and health outcomes. So go ahead and advance, Calvin. So specifically heart disease, those with worse gum disease or periodontitis see an increase in the risk for heart disease. And we see some very specific changes in vascular disease outcomes when those who have gum disease. That the actual bugs involved in periodontal disease have been cultured in hardened artery walls. And also the actual inflammatory markers and effects created by a body chronically fighting a gum infection has atherogenic effects. Atherogenesis is the process where your blood vessels harden with plaques, and that's considered vascular disease. So next, please. Diabetes is also inexorably linked with gum disease. Poorly controlled diabetics have a higher prevalence of having more advanced gum disease. And the converse is true as well. The more advanced your gum disease, the more diabetic you are. Values such as hemoglobin A1C and blood sugar control are worse in people with active untreated gum disease. And it's because, again, this chronic inflammation is linked to things like insulin resistance. So next, please. Hemoglobin A1C values, which you may be aware of. It's a common score tested to see, to grade your level of pre or current diabetes. And there are studies showing that your ability to control glycemic control or blood sugars is worsened by periodontal infections. So there are studies showing that diabetics who then get treatment by, say, having a professional teeth cleaning or taking antibiotics that target these bugs have actually improvement in these values. And I want to emphasize that periodontal disease, part of the reason it's so easily affecting so many adults is because it's subacute. It's not something that's readily felt or noticed. But if you yourself aren't really brushing or cleaning your own teeth, or certainly routinely, depending on your needs, getting your teeth professionally cleaned, it's likely you may be suffering from this. It's not something you feel, it's kind of boring, okay? And it's chronic. But as I'm pointing out here, it's this chronic subacute inflammation that seems to have a host of systemic or bodily poor outcomes tied to it. So go ahead and advance. As a former hospital dentist, aspiration pneumonia is something that I encountered quite frequently, more on a critical care level. Pneumonia itself accounts for a good chunk of hospitalizations, especially in elderly and frail populations. And it's demonstrated that the mortality rates due to pneumonia are higher in patients who have gum disease. Part of this is because bacteria from the mouth can then seed to other weaker parts of the body. Simply, inhaling or aspirating a loosened piece of plaque or tartar buildup, or even a chunk of broken down cavity, can lead to an infection in the lung. As a hospital dentist, I would routinely be consulted by infectious disease experts who were treating someone in the ICU who has an empyema or a lung abscess, and they took a culture of it to see what bugs were causing these abscesses and found oral bacteria. Bacteria that are supposed to cause cavities, not lung infections. So poor oral hygiene is correlated with this, as well as, just general frailty and impaired immune status. People who have a hard time breathing or swallowing or maybe lying down all day, they're at a higher risk here. So taking care of your mouth, cleaning it and reducing the bacterial levels in your mouth helps to reduce that risk. So go ahead. And then this is some new information. I have 2 links to news releases at the bottom from the NIH, or the National Institutes of Health at NYU, because Alzheimer's, which we're all aware, does disproportionately affect older adults. In and of itself, it's a disease process that is still being understood. We don't really know exactly what causes it, but you may have heard of some markers like beta amyloid protein or plaques as being correlated with the disease process for Alzheimer's. Well, older adults with gum disease are more likely to develop Alzheimer's and dementia. And beta amyloid protein, it is cultured in the cerebrospinal fluid of patients with periodontitis and more advanced periodontitis. And there are theories now emerging that the production of this protein might actually be due to periodontal disease, chronic infections. So the takeaway, again, this is still very new. We don't really know exactly what to take away 100% from this, but good oral health may protect against future Alzheimer's disease. So go ahead, next. So what are some challenges to accessing dental care and preventing some of these issues? As caregivers, you guys are encountering quite a few. Go ahead and advance. So older adults are more vulnerable to dental disease, and that's simply because the teeth, among other things, have been out and proud for a longer amount of time. So it's more likely as you age that some incidents of something like a cavity could have happened. At least 50% of adults suffer from one or more sites of gum disease or inflammation, and that number rises as you get older. And that's just because you're eating food your whole life and you have to clean your teeth your whole life, and things happen. Next. There are variations in self-sustainability. There are seniors that are completely independent, but we're here to really discuss those reliant on people like you, caregivers. In particular, those that are significantly mobility impaired are going to have a harder time getting to the dentist and a harder time taking care of their own teeth. Next. In particular, mobility impairment could mean being wheelchair or bedbound, but it could also mean just having like a bad wrist or arthritis and not being able to do things like floss or brush your teeth very easily. And so I have later on in this presentation some tips and tricks to help get around that. Mount Sinai is a major hospital in New York City, and they published a study with SCDA, that's the Special Care Dentistry Association. Mount Sinai has a home health, like house call physician nursing program in Manhattan, and they've surveyed their constituents and found that the vast majority of those patients, since becoming homebound, hadn't actually seen a dentist. And that was on average like 3 to 6 years. And the vast majority needed some form of a dental treatment. And as a dentist, I know even 3 years of not having a good dental cleaning can really lead to a lot of tartar buildup. And this, of course, is a reservoir for that bacteria and chronic inflammation. Next. Alzheimer's dementia, in particular, affects adults that are much older. It's a mental disability that keeps, that makes everything about caregiving and taking care of your own self completely either impossible or much more difficult because of the limitations of cooperation, inability to express oneself, including discomfort. So next. So, there are these challenges. I'm going to list them again. Inability to provide your own care, inability to express yourself, including when you're uncomfortable and need care. Other disadvantages, however, are advantages to you as a caregiver. If you need someone to control your diet and provide nutrition for you, you're at their mercy for that. But as a caregiver, this is something that's a positive. This is something that you can do to help them not only get adequate nutrition, but control cavities and dental disease. And you can also help to manage the frequency and quality of their oral care, because maybe on their own, they wouldn't brush their teeth every day, even if they were cognitively able to understand that that might be a good thing to do. So next. So the challenge really when it comes to caregiving, and I say here with dementia patients, but those that rely on a caregiver for their oral health and their oral health care, it really rests in your hands, not the patient. And studies demonstrate that the most significant factor in the oral health of a patient is actually the oral health of a caregiver. How good are you at taking care of your own teeth? And what's your dental IQ, so to speak? So the problem is twofold. First, we need to assess your oral health IQ and dental hygiene skill sets. And I do want to help figure that out today and help impart some knowledge so you can improve these things in your own lives. And then determine, once you have that knowledge, how can you implement those skill sets in an effective way to be a good caregiver, a good oral health caregiver for your loved one. So next. So where can we start? So I want you guys to become familiar with two mouths, your own and your loved one's mouth. And this isn't so you can compare between the two necessarily, but so you can generally and broadly become familiar with what a mouth looks like. And in particular, you can look for some things that might be in need of treatment. Specifically, mouths, depending on your coloring, have different colors inside. But in general, gums should be firm and pale, either in pink or brown colors. Swollen areas, shiny, smooth, swollen areas, and red areas are signs that there's infection, like from gum disease. Red in particular is a hallmark sign of infection. And going hand in hand with this, bleeding gums is not normal. If you, for example, notice when you brush your teeth or floss your teeth that there's a little pink in your toothpaste, It could be because you're injuring yourself, but more likely you have an area where the gums are inflamed. As a dentist, I often encounter new patients who are dissuaded or discouraged from doing things like flossing their teeth because they notice blood and they think they're doing something wrong. And I'm here to tell you that's not the case. The bleeding isn't because of injury, it's because that area needs to be cleaned a little better. There's bacteria there that's inflaming the gums. And if it's not improving, it may be because there's something hard in there that a toothbrush or floss can't get rid of. So within your loved one's mouth, look out for that. Certainly you can injure yourself. I'm sure most people have burned themselves on hot food before, or scraped themselves or bit their cheek. So these injuries like sores and lesions can happen, but they should resolve within a couple of weeks. If you notice persistent lesions in your loved one's mouth, that's a sign you need professional attention. Maybe there's a poorly fitting denture or appliance in there that's causing a sore, or a tooth that's jagged and sharp or broken, or it could be a sign of another infection, okay? That's when you would want to get somebody's help, a physician or a dentist's help. I'll get into denture cleaning and care later on in this webinar, but you do want to take care of those, as well as look out for plaque accumulation. So in this photo, if you look at the teeth, at the base of the teeth in the front, you see this fluffy whitish substance, and that's dental plaque, that bacteria-rich, broken down food material that you want to be sweeping away on a daily basis in your own mouth and in your loved one's mouth. Otherwise, it'll persist and harden into tartar buildup that needs to be professionally cleaned away. And I add in here a bullet point about bad breath. I find patients sometimes are a little less forgiving than me as a dentist when it comes to odors from the mouth. But what I'm talking about is an extraordinarily bad odor that can be a sign of an infection. And certainly when teeth are loose or broken, that's a sign that you might need professional intervention as well. So next. So what's a dental emergency then? Broadly defined, that's something that can threaten your well-being and your overall health in acute sense. So this picture shows somebody with a distended right cheek, ostensibly because a tooth has become infected. It may have been a chronic infection, such as, a cavity that's been there for a long time and never bothered anybody, or like a gum area suffering from periodontal disease that suddenly got something stuck. This is something that's like a medical and dental emergency, usually requires antibiotics systemically to be taken to help resolve bacteria throughout, but also dental work to figure out the source of the infection. Uncontrolled bleeding from the mouth also is an emergency, in addition to pain. Again, as a dentist, I routinely meet people in the office who are catalyzed to visit a professional because of pain, which is a logical thing to do. But I can't emphasize enough that pain is a poor feedback. Your teeth have a really poor sense of what's going on in the world. Healthy teeth can feel sensitivity and pain, and they're okay. And people can live with chronic infections and cavities and never be any wiser. This picture, this woman with a swollen cheek probably is feeling some discomfort from that swelling, but she may not even be feeling any pain from her tooth. So keep that in mind, especially when you consider as a caregiver, you may be taking care of someone who, even if they are feeling pain, won't really be able to express that. Okay, so next. And this photo, it's just zoomed in a bit better so you can see, for example, the gums there, they have that red halo. That's a sign of inflammation there. That's what you want to look over time to resolve and become smooth and pink like the rest of the gums. And the way to do that is by cleaning that fluffy white substance, the plaque. You always want to use a soft bristled toothbrush on yourself and on someone else. Don't use medium or hard because that's too abrasive to your gums and teeth and doesn't do any better. So soft toothbrushes. And the technique you should employ is one of a sweeping or circular motion of the toothbrush around the gums of the teeth. Think of sweeping it away gently while it's soft away from the roots and the gums. This picture also shows someone with older style metal fillings. Those are those dark gray spots. And actually, I want to point this out because this is something you certainly might notice, if not in your own mouth, but on an elderly person's mouth. Just because they don't blend in with the teeth doesn't mean they're necessarily a problem, okay? So that's something that's actually kind of normal. It's just the color of those metallic fillings. Next, please. So what are some goals that are realistic? As a caregiver, coming away from this webinar, I'm sure everyone will have something they'll take away from it and be able to apply to their own oral health and hopefully their practice of caregiving for your loved one. But I want you to be realistic. And I'm going to try to go over different options in each technique, for example, or tenet of oral health that I discuss. So you can tailor it to your own unique situation. For example, if the person you're taking care of is cooperative, that's going to be an extremely different experience for you being an oral health caregiver for that cooperative patient, as opposed to somebody else in this webinar whose family member is suffering from dementia or Alzheimer's. And same thing, there are different levels of mobility impairment. And I'll try to address all of these levels and give suggestions and techniques that apply to these. I mentioned earlier, one of your advantages as a caregiver is you get to control the diet and the hygiene habits of your loved one. So next, specifically, controlling the diet can help reduce cavities. So when I ask patients or people, most people can answer, oh, sugar and candy, that causes teeth to rot. Truthfully, if you took a tooth and set it in a bowl of sugar, though, and left it alone, nothing would happen to that tooth. But if you have a tooth in a mouth and you put sugar in it, and a mouth, mouths always have bacteria in them, the bacteria will get to work fueled by that sugar. It's the most readily available food for bacteria. And the byproduct of that breakdown of sugar or any food by the bacteria is acid. And this acid is what actually erodes and breaks down teeth. So your enamel is actually the hardest substance in your body, and it's the tough outer shell on your teeth. And it's all inorganic, meaning it's like a mineral content, like a rock. Not exactly, but the acid washing away the minerals is the start of the decay process of teeth. And then you add into that the bacteria then can invade further and further and wash away more. And that's how you end up with cavities. So compounding to that would be a diet that is, sure, high in sugar, but also high in acid. And this can be trickier to figure out even on a personal level, because it may be that there are acidic ingredients on a list on the back of the nutrition label of something like a beverage, but there's no like citrus line item or acid line item. So some common acidic beverages in particular are those that have bubbles in them or effervescence. Carbolic acid is what creates carbonation. So even plain seltzer water is acidic. Most sugar-free beverages, to compensate for the lack of flavor from sugar, they use citric acid or other acidic elements that also rapidly break down your teeth. Most diet sodas have the same pH of a lemon, okay? And, fruit juice too is arguably not very healthy nutrition-wise, but in particular tends to be very sugary and acidic. So when you consider these substances are able to bathe and coat teeth, you can see how this really, especially in a high-risk group, can lead to negative outcomes from a cavity-causing standpoint. Also, your mouth is like an environment that the more it's exposed to acidity or even just any food, the more the pH is going to drop and not have a chance to rebound back to neutral. So if you're constantly sipping on a beverage, it's more, other than say water, the constant exposure is allowing the bacteria to constantly work, or if it's an acidic, for example, beverage, it's constantly bathing your teeth in acid, and that leads to more cavities. Xerostomia or dry mouth, that actually has an extremely high influence on the cavity potential in patients who take a lot of medications in particular. And this disproportionately affects older adults because in general, older adults tend to take medications. And One of the most common side effects of medication use is dry mouth. Saliva protects your mouth and your teeth. Apart from allowing you to speak and feel comfortable when you chew and eat, it's a buffer, meaning it neutralizes pH imbalances in your mouth. And it's unique to you, but it has different types of antibodies, for example, that fight bugs in your mouth. So the less saliva you have due to dry mouth, the less buffer and more cavities you have. And in patients newly on certain medications that cause these dry mouth issues, the impact is quite rapid and severe in that lots of cavities can form very quickly. So next. How can you fix this? Apart from just brushing and flossing, which I'll get into more with technique, chemically, you can help neutralize the mouth with fluoride. Okay, fluoride is a naturally occurring mineral, and it does a couple of wonderful things for your teeth. It kills bacteria that causes cavities and even gum disease, and it incorporates into the broken down, washed away enamel to remineralize it. And when it does that, as due to its chemical composition, it actually makes the enamel matrix harder and therefore more cavity resistant. And we have decades of proven efficacy for fluoride use in cavity prevention and dental disease prevention. So the main reason toothpaste should be used is as a delivery mechanism for things that replenish the teeth, such as fluoride. It's not really for the minty flavor. And this, I want to emphasize, should be used in addition to any fluoride in the community water supply. I'm tuning in here from San Francisco, where the city does have fluoridated water. And this is helpful for preventing cavities, and in particular, really helpful for those with developing teeth, like children, because it allows the fluoride to incorporate into the enamel of those teeth. However, it is not an alternative or substitute for the topical application of fluoride. And this is because once your teeth erupt and are out there, there is a small blood supply into the tooth, but really your teeth are there. Anything you want to rebuild or regrow the enamel has to be applied on top of it. So that's where mouthwashes with fluoride and toothpaste with fluoride will help. Other products, xylitol is actually a sugar that cannot be broken down by bacteria in your mouth, and it actually kills bacteria. It's present in a lot of chewing gum and lozenges like Orbit's gum or Trident. If you look on the packages for these types of gums, you'll notice the ADA seal of approval. That's the American Dental Association seal. And I'll show you a picture of that later on. And then toothpaste and products that have other minerals like phosphates and calcium can help in addition to fluoride. So next. Here's some pictures demonstrating how you should approach brushing someone else's teeth. So you don't want to stand in front of someone and push a toothbrush in and out like a drawer. That's going to be uncomfortable for you, actually, ergonomically, and it's likely to result in poor technique and excessive force on your patient. So sit or stand behind them while they're comfortably seated and brush from behind, because this will mimic the technique that you use to brush your own teeth. And again, soft bristle brush, sweeping or circular motions around the gums. Next. I have some pictures here of aids to use, both for cooperative and in particular, non-cooperative patients. On the left, you'll see this person is using a mouth prop, sitting behind their loved one, brushing their teeth while they're lying down. Using a prop can safely keep someone's mouth open. Please don't use anything hard because you could cause injury to the teeth if you have someone bite down into something really hard. But you can Google and find this product. I don't really like to plug products per se, so but look for a mouth prop. It should be firm but spongy. This particular one has a durable core, and it's like a hard foam on the outside, and it can be washed and reused and eventually disposed of if it wears out. On the right, you'll see on the top photo, someone, even if their mouth is open or not, someone who doesn't want you in there to brush their teeth, you'll notice they'll pucker their lips forward. And so using a retractor can help improve the access to more back teeth, even on a cooperative patient, to be able to brush a little more effectively all around and not just in the very front teeth. So I have a picture here of a metal and a plastic one. Again, if you Google cheek retractor or mouth retractor, you should be able to find some of these. Always make sure you moisten or wet these retractors under the tap so they're not dry going in. And consider using chapstick or Vaseline on your loved one's lips to make sure you're not dragging or pulling anything. Next. Depending on the cognitive ability and cooperability of your loved one, there are ways to use the existing oral hygiene tools that they have to make them a little more comfortable to be used for them, like using a tennis ball even, just to help improve the girth of the handle. If someone has an arthritic hand, you might not be able to grip a small toothbrush the same way, or like a bicycle grip is also helpful. Next. Here are a couple of examples of manual toothbrushes with soft bristles that are a little more efficient at brushing as well. You can see these brushes have longer bristles that surround the teeth all around. So that way, when you're brushing a few surfaces at once instead of taking time to go one and then another and then another. So next. But ultimately, I actually would most highly recommend some form of electric, ideally rechargeable toothbrush. There are a few brands emerging here, but the best would be the Oral-B or even a Crest Spin brush, though that's battery operated, simply because the mechanism of action for those brushes is that they have a very small head, so it's easy to get to far in the back places, again, even in your own mouth. And the way they work is they turn on and the bristles rotate or oscillate, kind of like if you've seen a street sweeper cleaning, these round brushes scrubbing. And instead of brushing, which again, especially when you consider brushing somebody else's teeth, can be tricky or result in injury, they spin for you. So you just place it on the teeth and advance it tooth by tooth so you can cover all surfaces there. A note about these, however, if you are taking care of someone with dementia or Alzheimer's and they're not familiar with this type of toothbrush, it may not be accepted by them just because it's got a very unique feel and a sound. And so just keep in mind that might be a bit of a failure there, even though it would make your life a lot easier and help you clean a lot better. But if that happens, I would say just keep the toothbrush for yourself because they are proven to clean a lot more efficiently. You can share it with a loved one because the toothbrush heads come off, so you can share the actual unit, and they do clean very well. Next. This is a picture of one type of water flosser. It's not a substitute for flossing if someone has all of their teeth, because flossing is the best way to clean in between. But what I notice, especially in those with more advanced cognitive decline, or even otherwise, is that you might notice food debris pouched in areas that aren't being swallowed, pouched in the cheeks or underneath the tongue. And this causes inflammation. So using some water like this to jet that out can help, as well as cleaning in areas where someone has large gaps between their teeth or appliances in their mouth, like bridges and implants where there are gaps. That's where the water pick is really useful for. And there's different brands of it. Next. Flossing, as a dentist, I know everyone's a little, not everyone, but quite a few people are pretty lazy about doing it and feel that brushing is enough. And unfortunately, I have to be a dentist and say that flossing is really, truly important. If you're not flossing your teeth, you're just not brushing a good chunk of the critical areas of your teeth. If your teeth are touching together, there's no way for you to actually brush in between them and remove that plaque buildup in between the teeth, and even more critically, in the gums between your teeth, which that occupies a good chunk of surface area. So flossing, even for yourself, can be made easier if you have a hard time reaching string and your fingers back into your own mouth. And certainly as a caregiver, I think that's going to be very tough as well. You can get floss that's pre-ligated on little handles or picks, and they're angled such that you can slide them between the teeth from in front of or behind somebody. And the appropriate way to floss is this. Your floss, the whole point of flossing is to brush your teeth in between the teeth. So you slide the floss beyond the place where teeth touch, like the contact. You might feel like a little resistance or that snap there. And then you hug the floss around one side on one tooth and gently scrub up and down. And you use it in a scrubbing, brushing motion to lift food out of the gums. And then you go to the other side and then advance it to another contact point. I mentioned the ADA symbol. Okay, that's pictured here. This is something even in your own personal oral hygiene and care, look for that symbol on products, because the American Dental Association vets products for their efficacy more than just, FDA approval to make sure they're not going to kill you. And in particular, they help to ensure that there's enough cavity fighting agents in the toothpaste or mouthwash, for example, that you use. Down below, the big picture with teeth shows an example of an interproximal brush. They're like little pipe cleaners of different sizes. Start with the smallest size first and graduate up depending on how big the gaps are between your teeth or someone else's teeth. This can be a great alternative to flossing or an adjunct to flossing, because you just gently slide that little brush and scrub back and forth and then move to the next spot. And mouthwashes are helpful. If your loved one can rinse, always make sure it's alcohol free. So the burning sensation of certain mouthwashes is not good. Always look for 0 alcohol, and ideally with fluoride, because the fluoride, again, is going to replenish the enamel in addition to killing bacteria. If the person you're taking care of can't swish and spit on their own, you can use a mouthwash on like a piece of gauze, for example, and dab it onto the gums, and that can help. And I did include one brand here. I don't really care about the brands, but unfortunately, there aren't so many options for dry mouth products over the counter. You might have seen Biotine, but Act Dry Mouth in particular tends to have more cavity fighting agents included with their products, in addition to things that help soothe uncomfortable dry mouths. And pictured here are lozenges. They're like little hard candies, which are nice. And they provide not only comfort and a good taste, but cavity fighting protection. Okay, next. But there are prescription hygiene aids, meaning you need to talk to a dentist or possibly a physician, but usually a dentist is a better bet to get a prescription. Chlorhexidine is a prescription mouth rinse that's particularly effective at killing oral bacteria, especially in periodontal disease. It's generally not used long-term, but as a caregiver, it can be very helpful, especially if you have someone who's not able to get to the dentist very frequently. Again, dab it on like a piece of gauze and wipe it on the gums where there's redness, and it will help calm that bacteria, kill the bacteria and calm the inflammation. And I would highly suggest considering getting a prescription for a highly fluoridated gel or toothpaste beyond what's available over the counter. We're talking 5,000 parts per million of fluoride. I have listed some common meaning commonly carried products, brand names that dentists often have, but there are generics as well. This type of toothpaste is incredibly effective at preventing and curing dental disease in vulnerable patients. And again, in yourself, if you feel like you're cavity prone, because genetics unfortunately has a play with all aspects of health, including cavities, then having the extra fluoride around in these toothpastes is going to be wonderful for you. And fluoride unfortunately gets some negative press for many different reasons. Toxicity is really not something you should worry about. It's really only relevant for, say, an unsupervised child with a tube of toothpaste they think is yummy and they eat a whole bunch. Otherwise, swallowing small amounts of toothpaste, if you're brushing somebody else's teeth, is okay. In fact, the American Dental Association with Young Children recommends fluoridated toothpaste for little kids, even as young as 3, brushing their teeth with a rice grain sized amount, because if that's eaten twice a day, every day, that's fine. In fact, it would help kids and the development of the future enamel of their teeth. So similarly with your adult loved one, when you brush, you don't have to worry about rinsing, okay? And the instructions for use for these types of toothpaste often instructs that you don't rinse, because leaving that fluoride around helps to continue to buffer and neutralize the pH in the mouth and replenish the enamel. Next. So you as a caregiver are going to be the expert at behavior management. You have probably figured out, or you're soon to figure out, your way of finding out what's the best way to communicate with your loved one. You do need to exercise patience. When I talk about setting realistic goals for yourself, be realistic and patient and take things one day at a time, and find the right place and right time to engage in activities like brushing someone else's teeth, which might not be something they want to do. Next. So some tips and techniques. Here, there's a patient, as you can see, is getting her teeth brushed, and she's holding in her hand a toothbrush. So this is called bridging. In this patient, I'm assuming has cognitive decline and is not able to brush her own teeth, and might not, in and of itself, having someone go into your mouth, it's a sensitive thing, might not be so cooperative with having her teeth brushed, but holding the toothbrush, in addition to having her teeth brushed and sensing those things together, it kind of clicks, it makes sense. But again, be careful. You don't want to give this to someone who may be combative. Next. And then you can make getting teeth cleaned a fun activity by linking it with, say, having the right music or a movie or a show on. If nothing else, just as a distraction to what you're doing. Next. Chaining is whereby you and the patient together brush teeth, for example. This photo shows someone else brushing a loved one's teeth and her taking over, and vice versa. Again, this may or may not work for you and your loved one, but it can help engage the senses and improve cooperability. Next. So dentures, although they are not teeth, do need to be cared for and cleaned. You should brush and rinse them every single day. So take them out and brush them to remove food and plaque. Otherwise, what you will find is that even though they aren't teeth, the same bacteria that resides in your mouth will get onto the dentures, and the food will stay there and it'll form dental plaque. And again, that's the same issue. You don't want that bacteria hanging around in there all the time. And dentures should be removed for at a minimum 8 hours a day or night, ideally. A good analogy is that you wouldn't, wear your shoes all day or all night. Some bad, funky things that happen to them, like fungal infections. So you need the gum tissue to get some rest and cleaning. Pictured here, you can use is a denture brush. It's just like a larger brush that you can use to clean them. There are marketed a lot of like denture cleaners and things to soak dentures in. You actually do not need that. Just mechanically brush with cold water. Heat can sometimes warp these materials, so be careful of that. Don't put hot water onto them, but brush with just hand soap, mild detergent to clean off any plaque. Next. Otherwise, if dentures, for example, aren't cleaned properly or are left in chronically, a natural overgrowth of the mouth yeast called candidiasis or oral thrush can arise. And that's in particular something that immunocompromised patients are vulnerable to, but also patients who chronically wear appliances without removing or cleaning them. And it's characterized by sometimes bleeding, but swollen, red tissues, and those whitish plaques are the yeast plaques that can wipe away. And this needs to be treated medically with an antifungal, as well as allowing the tissues to breathe. Next. So how do you remove dentures? So depending on the quality of the dentures and your loved one's luck with them, they may actually be very retentive, especially the top dentures. Dentures form a seal with the roof of the mouth, and they get their suction basically from having a broad, flat contact with as much surface area in the mouth as possible. So upper dentures, considering there's a big palate to suck onto, can be pretty secure. So if you go in and pinch them and you find that they're not coming out, don't worry. The way to dislodge the seal for a denture is to tip it forward. And I have very explicit instructions here just to help you in case you're tasked with doing this. But you want to tip either one hand or two hands forward, and that'll kind of break the seal on the palate, okay? Tip from the front. Lower dentures, owing to the fact that lower jaws just have less surface area, they're usually much looser. And actually, often patients use Fixodent or Polygrip, those denture adhesives on those areas. Keep in mind, denture adhesive is great to use, especially in a loose denture situation, but it must be cleaned off every single day. Otherwise, it's also a nidus for infection. Lower dentures should be easier to pop out, but if they are quite retentive, you want to use a similar to the second strategy above. You want to hook your thumbs under the edges of the denture on both sides and at the same time pop up. And this is especially true if there's like implants and snaps to make them really stick. All right, next. Partial dentures are those that replace teeth where there's some teeth remaining. So they get their retention from metal hooks or clasps hugging around key teeth in the mouth. So to dislodge those and clean them every day, you should put pressure on the clasps. For an upper partial, you'll notice the clasps look like little mountaintops. On a lower partial, they'll be U-shaped. Okay, and you want to find those clasps and with both hands pull down on them or pull up on them for a lower denture, and that will take them out. Next. But I've been alluding this whole time that ultimately this webinar isn't going to turn you into the dentist, and you may need professional care, and you may even need it urgently. So I have some suggestions for you. I will get into the first bullet point in a later slide, but registered dental hygienists and alternative practice are a great resource for those of you tuning in from California. Oral and maxillofacial surgeons are a wonderful resource as well, and they are a nationally recognized dental specialty. So dentists that undergo additional training to do quite a lot of surgery in particular, and many have private practices geared towards offering sedation services and even hospital OR sedation services, which is really helpful when you're talking about providing medical anesthesia for a very frail elderly person, to do things like remove infected teeth and deal with emergencies and facial abscesses. However, this is, as essential as that is, this can be a limitation. They don't provide preventative services like cleanings, for example, but a good oral surgeon may be able to point you in the direction of, even just taking x-rays and evaluating if there's something wrong and triaging for preventing future emergency care, which is very valuable. Okay, sedation is something that can really help an anxious patient, a non-cooperative patient, and there are dentists with different levels of training to be able to provide care while someone is sedated, even with just a pill, or while totally asleep with an IV, for example, or in a hospital. In particular, hospital dentistry tends to really not exist unless you're in a major city. But many major cities, especially if you look for those with resident programs for dentists to be trained in hospitals, those are a good resource for getting dental care in the operating room. There are dentists, although there is no specialty of geriatric dental medicine per se, there are dentists oriented towards this. And especially as this is like not something that is well organized, being very truthful, this can be difficult to find. So just do some searching. Apart from, the usual Google, you can reference your state and local dental society. There are societies in every jurisdiction in this country, and they may be able to give you advice because they tend to keep information about this type of specialized care. And then Special Care Dentistry Association, which I mentioned earlier, this is a voluntary organization for dentists to join that are interested in these kinds of services. So next. And then registered dental hygienist and alternative practice is something that us Californians can use. Dental hygienists normally work in an office under the direct supervision of a dentist to provide things like dental cleanings. But in California, hygienists can undergo additional training to be allowed to work in the field a little more independently. So they could visit at a nursing facility, for example, or senior home or a private house and complete an oral health exam, a teeth cleaning. And probably the most important thing is they can recognize problems that might require advanced care. So you can selectively, for example, invest in the effort or finances of transport to a dental office, for example. And they can also help you out in terms of furthering your oral hygiene instruction knowledge and help you point out things that would benefit your client. So next. Here I just have a photo of a before and after a cleaning. If you look at the before, this person's teeth has hardened tartar deposits, especially along the bottom teeth, that on the right side are now gone. And that's kind of what we're looking for with hygiene services, is cleaning that tartar buildup. So then you then can go in and brush and floss or use interproximal brushes to keep it this way. And that really concludes everything. I see on the bottom, I haven't been looking at the Q&A, the questions like that came in. I definitely want to take a look and see and help answer some questions here. So let's see. So someone has asked how, so this person has an uncooperative patient with dementia who's struggled at getting a dentist to help them get an x-ray and sit in the chair. How can you find a dentist who will work with an Alzheimer and dementia patient? Being very honest with you, this is something that falls out of the scope of a typical private dental practice's offerings. Looking for dental schools or for hospital-based programs is great, and also consulting Special Care Dentistry Association to see, and even calling offices and seeing if anyone markets themselves as geriatricians, even though there's nothing like that per se. What if someone has an extreme gag reflex and refuses to cooperate with the dentist? Assuming this is someone who is has like otherwise a cognitive realization of what's going on, this is actually where sedation is helpful, because if the gag reflex is so severe that an experienced x-ray tech or dentist can't get around it, that unfortunately happens, but you're a great candidate for having dental care done while asleep. How often should people with dentures go to the dentist? That's a great question. Fortunately, when you don't have teeth, you don't have as many risks involved with dental disease, but oral cancer screenings are recommended at least once a year, meaning just a non-invasive visual look by a dentist or a hygienist. Let's see. Lots of questions in here. This is great. What if someone's resistant to sleeping without dentures? Well, ultimately, you can only point them in the right direction, demonstrate the pictures of candidiasis. That's not a remote risk. That's something that happens quite often. Let's see. Is there specialty dentistry covered by Medicaid or Medicare? Unfortunately, I am not sure about this. I know that there are dental schools and hospitals that provide, in a past life, I was a resident in Boston at a couple of hospitals. I don't know if anyone here is tuning in from Massachusetts, but MGH or Massachusetts General Hospital and Brigham and Women's, and I know many other hospitals in the Northeast and otherwise that have residents, they do provide Medicare, Medicaid services to their constituents, including in a dental capacity. And that would be one place to get this care. I did see patients as a resident in the OR who we could use Medicaid, Medicare. Is the color of the tongue something to be concerned about? There are some medical conditions correlated with discolored tongues, like if a tongue is very, very red, for example, or if you notice bleeding. But tongues actually have different anatomies and colors. Okay, so if you see spots on the tongue, it's not necessarily an issue, or like a dark color. I see a few questions about that. The actual papillae or the taste buds have like a fibrous end to them. So they can grow a little long and become discolored, like yellow and black or whitish. The way to treat that, it's not an infection per se, but it's just to brush the tongue or use a tongue scraper, and that'll clean that off. Calvin, I thought I heard you chime in there, but maybe not.
No, sorry. I was actually just, I was thinking something that I know that you have to get back to seeing patients and doing the great work that you do, taking care of caregivers and the people they're providing dental care for. I was wondering maybe if you could just answer, I guess, one last question about a listener who wanted to know about kind of the COVID situation with getting dental care. I know we're hearing a lot about the Delta variant. I'm sorry, I know you're not an infectious disease expert, but I mean, what might be some of the considerations for someone going to maintain their own dental care by visiting a dentist, or maybe for someone, a loved one, a family member who might have dementia or some other other concerns?
I mean, that's definitely a great question. It's such a concern, even among dentists, because of course this pandemic is so new for us. But what we've been finding is that dental offices pre-pandemic, everything you encounter in a dental office is either disposed of, sterilized, or completely disinfected, and with barriers. And this is stuff that has been long enforced by law. And so that helps with reducing aerosolization of the actual deposits, contact spread. Most dental offices are employing air filter systems to reduce aerosol into the air, which is the real concern, right? Because we know COVID spreads by air droplets. The latest, I should find this article, but the latest studies have shown that of the dental aerosols that are generated from, say, like using a dental drill or an ultrasonic cleaner, which was the biggest worry, most of that, the vast majority of the content of that is actually non-infectious. It's actually the irrigation used to provide that service, meaning it's all water. So, for example, like a dental scaling device, which a lot of us practitioners have really tried to minimize using just to avoid any aerosols being generated. But even a dental drill, there's no way around it. It creates aerosols. The vast majority, like 90 or more % of that actually is water. So that should hopefully reassure you. And it's been, unfortunately quite a while that we've been in this pandemic, and the actual incidence of infected patients and infected dental staff, because again, not to be completely selfish, but as a dentist or a hygienist, or even just someone at the front desk, the big worry is that you're in a public facing role that is so vulnerable. The actual infectivity rate of dental professionals is very low. And it's what we're finding is that people are not getting infected at the office per se. But there's personal risks to vet out, right? If you are at the very least aware that you've been to the dentist routinely before the pandemic started, you've been cleaning your teeth well, you haven't forgotten your toothbrush while this has all been happening, you're probably going to be okay. I'm speaking very broadly, but if you know yourself that you've been recommended extra dental work that you haven't had, then I would consider going in to avoid, an emergency situation happening.
Great, thank you so much. I think that is just about all the time we have for now. I see it's 5 past the hour, so I'm going to get a quick evaluation poll launched. So thank you for filling that out if you have a quick moment. I'd like to thank you all for participating in today's webinar, again presented by Dr. Rosa Mathai. She's been a guest on actually our caregiver colleges in the past, so we're very happy she was able to spend some time with us this afternoon. So thank you again, Dr. Mathai, for spending this afternoon with us.
For sure. And I'll look through some of these questions and try to answer them as well. But if you guys have pressing concerns, my email is actually my first and last name, DMD. So like one of those first slides that had my Rosa Mathai DMD at gmail.com. And certainly refer back through the slides. That should help too.
Thanks. And we'll definitely get the slides up on archive. I know a lot of people have asked about that. So awesome. Next month, actually, we're going to be talking millennial caregiving. Should be another interesting topic with Aisha Adkins and Jen Chan, who are both former and current millennial caregivers, and both still involved with aging and caregiving. So again, you can find our information about our webinars at our website, caregiver.org, which is also where we'll get the recording of this webinar posted in addition to the slides. If you have any questions, again, Dr. Mathai mentioned you could reach out to her directly, or you can always send them to me, chu@caregiver.org, Charlie Hotel Uniform at caregiver.org, and I'd be happy to forward them to the doctor. So thank you so much again, everyone, for participating. That's about all the time we have for today. I know Dr. Mathai has to get going to work on patients, but I'll keep the line open for a little bit for the evaluation. And then again, if you have any questions, you can ask them, or you can just send the email to me. So thank you so much. Take care. And I hope you all have a great afternoon.
Thank you.